I'm Dr. Mike Milligan. I'm here with Dr. Dennis Abbott, general dentist from Dallas, Texas, and dental oncologist. Dennis, thanks so much for being with us.
Thank you very much for having me.
Talk to us a little bit about oral cancer and what we need to know to help our patients with oral cancer, please.
I'll tell you what, when I was in dental school 20 years ago, we kind of had a profile of the oral cancer patient.
Right.
It was usually an older man, smoker, drinker, loved his scotch, loved his cigars, more that was the profile.
Right. Slept on the street.
That's it.
Okay.
But things have changed, and really with HPV, with the human papillomavirus really becoming more of an etiological player in that field, we're seeing the disease happen at a much earlier age. We're seeing patients in their sometimes 20s, but 30s and 40s, a lot of 30s and 40s, getting base of tongue tumors, getting laryngeal cancer, getting tonsillar fossa cancer and posterior pharyngeal wall, and it really has changed things. So we really need to be diligent in screening. Mm-hmm. Oral cancer screening, I feel, needs to be the standard of care in every practice. So whether that is done with just visual and palpation, it takes both, or if the doctor is incorporating, or the hygienist is incorporating also in addition to those an adjunctive device, that's fine, but we need to be screening for these patients because it's something that we can't just really profile anymore.
How often does the screening need to be done?
We screen in our office at every recall appointment.
Right.
Okay.
Good.
And so we do use an adjunctive device. We use the Identify.
Okay.
And so we also have our patients understand that as part of the wellness plan, mm-hmm. an annual wellness plan, we would like to screen them with the adjunctive device as well.
Every 6 months or every year?
So we do every year with the adjunctive. We do every 6 months. Palpation and visual. Okay, so head and neck exam.
And extraoral.
Absolutely, absolutely. But here's how we relate that to the patient. Ladies, you go in for a mammogram, you go in for a pap smear. Gentlemen, you go in for a PSA test or a colonoscopy.
Right.
Those are screening tools that help us be able to detect cancer elsewhere in the body. Why not be able to look and have this device be able to screen for abnormalities or something that we see that we might need to go ahead and say, you know what, I don't like the way that looks under the fluorescence, let's go ahead and have that area biopsied or something like that.
Absolutely. What else can you tell us that we ought to know? What you've seen in the way of progression, disfigurement?
I'll tell you, from my experiences with people that have had oral and head and neck cancer,
right.
And that's not the 100% of the population that we serve, but it's a large portion because the treatment is so severe to the oral cavity and affects it so much, especially with radiation. But the disease in and of itself is a tough one because it affects not only the mouth, it not only affects a lot of times the ability to eat, but it will also affect taste. Nutritional compromises can follow, being able to hydrate correctly. A lot of times these people are placed on PEG tubes because they can no longer swallow. They've lost swallowing function. And that can lead to a lot of social and depression issues where they're not able to go and eat with their family. They're not able to enjoy the foods that they once did. That leads to sometimes a failure to thrive and they kind of give up. Right. And in that case, really the battle's over, and that's unfortunate because we really have to look at this disease as one that affects the entire person. It's not just affecting their head and their neck or their mouth. Right. In the cases like you were talking about with disfigurement, it's a hard thing whenever you wake up in the morning and the person that you see in the mirror isn't you anymore, or the person that you know that you were. And so again, that gets into the emotional health and the psychological health of these patients. So it is a devastating disease. It's one that we really need to do our part to try to be able to screen for and get people into treatment early as much as we can, because we found that if we can treat at an early stage of oral cancer, we have about an 80 to 90% survival rate for 5 years.
Okay.
Unfortunately, most oral cancers aren't found until they're stage 3 or stage 4.
Right.
And all of a sudden now I have a lump, and that lump is actually a node, and that node has metastatic disease in it, and we just have all of these other problems here. And so we get into a situation then where we have about a 43, 45% survival rate for 5 years, and it's devastating. And especially when it is, like for example, I'm treating right now a lady, 39 years old, mother of 5, stage 4 oral cancer. And so those are tough. And so again, it's something that when we have the power as dentists and hygienists out there to make a difference in these people's lives and try to protect them as much as we can, I think that that's our calling.
What's the prevalence out there? I mean, you see it now and then, but I think some of the patients and probably some of the healthcare providers out there even feel that, well, it's so rare, I'm probably not going to find.
It's actually the sixth leading cause, the sixth leading cancer in the U.S.
The sixth leading cancer in the United States.
Yeah, most prevalent. Yeah.
So
the
prevalence is there.
There is there, and they estimate that somewhere around 40,000 new cases are diagnosed every year. It's like that there are
43.
Yeah. So it's in that neighborhood. Yeah. So it is one of those cancers that, if you practice long enough, you're going to see it.
Oh,
you know,
yeah.
and so
seen it.
yeah, we are too.
Never
and so you just don't want to let your guard down on that.
Right. Yeah. It could be your wife or your family member or your next door neighbor, and all those patients under your care. You just want to take good care of them the way you would want them to take good care of you.
Exactly, and you bring up a good point on that, because it's, like I said before, it's not just the smoker, the drinker. A lot of these people have never smoked.
Right.
A lot of these people, I mean, I have people who have oral cancer that are triathletes, that run marathons. It doesn't matter. Once HPV becomes part of the equation,
Right.
And I think that that's something that dentists need to know too, that HPV is not like HIV. It's not a lifetime infection, okay? Right. The virus can be cleared through the immune system naturally, and sometimes we estimate that it's probably in the neighborhood of around 6 to 7 months from the time of exposure until the time of final clearance, in most cases. But in about 2% of the patients, there's something that happens during the infection at a level where either speculate that there's some kind of a latency that happens either with the virus, or there's some kind of genetic change that takes place. And a lot of these get into the genes of the virus and the genes of the humans, and P53 and RB and some different genes that the early genes 6 and 7 of the virus actually affects. And so those actually cause a loss of the cells to undergo apoptosis whenever they have messed up DNA.
Okay.
And so what we'll see then is this genetically mutated bad cell gets to just continue to live and reproduce and reproduce and reproduce, and then we have a problem. So you really have to be aware that it is not just the older people who are smokers anymore.
Yeah. Any last things you'd like to tell us about oral cancer here before we close?
I think that the one thing that I would encourage dentists to do, if they don't know, is to try to understand the treatment for oral cancer, to understand what their patients are going to go through that do have oral cancer, and I think that helps us be better care providers, because it's a hellish type of a treatment, and it's tough, and also I think it educates us and puts us in a position to not only be more compassionate, but to also realize I don't want my patients who are under my care to have to go through this. If I can try to keep them not from being able to get cancer, but get it in an early stage where they may not have to be subjected to such the severity of the types of treatment. I think that's one thing that we don't really understand, and that would be a good, that would be a helpful.
Where can we get more information?
There's actually a very, very good website of a nonprofit called the Oral Cancer Foundation. That has a fantastic resource, not only for doctors and dentists, but also for the lay public. And so that's something that you could get a lot of stats and a lot of some talks about that. We always would be happy to have people in our courses. We do a lot of courses on oral cancer. And so they could check out my speaker site and see where I'm going to be lecturing, and see if we have an oral cancer topic coming up and maybe in their area. And that website is drdenisabbott.com.
Wonderful. Dr. Abbott, thank you for all you're doing. Thanks so much for being with us today.
I appreciate it. Thank you. Thank you.